Well, I think we are right at time on my end, so I am going to go ahead and get started. And first, I wanted to thank everyone for joining us. I know these webinars can be hard to fit into your schedule, and they're always available on our YouTube channel. So I appreciate those of you who carve out the time to be here with us in real time and ask questions, hopefully at the end. This is our first Family Services webinar of 2021, and today we'll be finishing off our first quarter of the advocacy series. So hopefully you've all seen and heard this new program here at the IFOPA mentioned multiple different times by now. This is our resource webinar. So this is our third and final resource for the topic advocacy, you can make a difference, which was just really our general exploration of what advocacy can mean in a lot of different settings. It was just sort of an introduction to the role of being an advocate. So if you've missed our podcast and our worksheet, those were released in January. And then last month we did a community panel. I'd encourage you all to go back and take a look at that. We hope you'll enjoy and take some time to explore those resources as you join us on this journey to becoming a more effective advocate for yourself and your loved ones. And my name is Hope Newport. I'm the Family Services Manager here at the International FOP Association. And I just wanted to start by going over a few of the housekeeping parts of Zoom. I'm sure you're all very used to it by now, but the webinar platform can be a little bit different. So if you all move your mouse cursor across the bottom, you should see a Q&A button. So you can submit questions directly to Lisa or myself. And if those apply directly to what she's talking about in the moment, I can chime in and ask those. Or if it's a more general question, we may wait and hold it till the end. And there is also an option, I believe, for you all to participate in a chat. So if you are having any sort of technical issue or you just want to share an experience related to what Lisa's talking about, please feel free to send those in the chat. You'll notice that you don't have video or audio, and that's just to limit any background noise from coming through. If you would like to ask a question, at the end, I can unmute you so you can speak if you'd like to just ask your question as opposed to submitting it through chat. That is a possibility as well. And I just wanted to remind everyone, especially those of you who are maybe scrupulous note takers, that this webinar is being recorded. So you'll be able to go back and view any of Lisa's slides afterwards and hear her presentation as well. And then I wanted to make sure you all knew ahead of time that you will receive an email with a link to the recording and also a link to a survey for this quarter's resource. So the survey is going to cover the podcast, the community panel, and this webinar. And it's really important that you complete that survey because Karen and I will be sending out our free advocacy resource workbooks. So those workbooks will capture all of the great information we've shared already this quarter on this advocacy you can make a difference topic. And those are free for you to receive, and we'll be sending additional inserts to go into those workbooks throughout the year as we continue to cover more information. So I wanted to take a minute to introduce our panelist or our presenter for today. So Lisa Schill is joining us. Lisa has over 10 years of experience in the rare disease community, from personal experience raising an individual with RASopathy and working with nonprofit organizations, industry, and government agencies. Lisa provides organizations broad experiential insight and direction. From 2015 forward, she's provided leadership and strategic guidance for the top rare disease advocacy organizations. Some of you may know or have heard of Global Genes or Every Life Foundation to help them tackle patient access challenges. She's expanded and refined advocacy educational programs, created collaborative learning opportunities, and managed major rare disease events, as well as influence legislation, which I know she's going to tell us a little bit about today. All of this to accelerate treatment options and improve the lives of patients and families. So we are so fortunate to have Lisa joining us here today, and I'll pass it over to you now, Lisa.
Oh, thank you. Thank you so much for having me here today. I'm really excited. I'm going to start sharing my screen so you can see my slides, and then we can get started. I wonder if it's going to do it. I wonder if it's going to, okay, there we go. All right. So I'm here today to talk about becoming an empowered advocate. You are all superheroes, and I hope by the end of this IFOPA series on advocacy, you will be able to turn hope into action. And how? By following the steps to becoming an effective advocate. Believing in yourself, knowing what you want, getting the facts, gathering support, expressing yourself clearly, and setting a clear call to action, what you'd like others to do. So my journey into the rare disease world started with the birth of my third son, Max. He was whisked away to the NICU in respiratory distress. The problems seemed to mount from there, leading us on a diagnostic odyssey to find the source of his issues. It would take 1.5 years to get a diagnosis, which I thought was such a long time, until I learned on average it takes over 7 years to be diagnosed with a rare disease. So my son was diagnosed with a RASopathy, specifically Noonan syndrome. And the RASopathies are a group of genetic conditions caused by mutations in the RAS-MAPK pathway and affect cell growth and cell regulation. And these are mostly gain-of-function mutations, and about 30% of cancers lie on the same pathway. And these syndromes have many clinical features in common, such as distinct facial features, developmental delays, cardiac defects, growth delays, neurological issues, gastrointestinal issues, and sometimes cancer. When my son was diagnosed, I was handed a written note with the next 12 specialists we would need to see. At the time, there were no active advocacy groups that I knew about, and so I felt really alone on this journey. So you are also lucky to have the IFOPA, who's here to help guide you and teach you about advocacy and FOP and many, many other things that advocacy organizations do. And, you know, what comes after a diagnosis? Answers? For me, and I bet for many of you, we were just left with more questions and not really a clear path on where to go next. Kind of like this map of the Tokyo subway system, not very easy to navigate. So Dr. Google became my new best friend. So my first plan for my advocacy was to learn as much as I could about my son's condition by reading the most recent and reputable journal articles. You always have to remember recent, because sometimes there can be stuff out there that's online but not as accurate because it's so old, and connecting with other families online to learn about their experiences. I also decided I wanted to help advance research of the RASopathies. So I had to learn the drug development process and learn what was needed to advance RASopathy research. And I also knew to advance research, you needed to advance legislation. So then I needed to learn about the legislation process. And I found an organization called the RASopathies Network that was hosting RASopathy scientific symposiums. And I worked to become the vice president of the organization and expand the organization to raise money for research grants, have an online presence so other people could find them, because I couldn't when I first had my child was first diagnosed, and present at conferences like the Rare Disease Day at the National Institutes of Health. We're also recently partnered with the National Cancer Institute to start a longitudinal natural history study that will collect information about families over time. From my volunteer work at the RASopathies Network, which I still do, I collaborated with Global Genes to create some of their toolkits to help families navigate their rare disease journey. You know, navigating health insurance, gaining independence as a young adult, using storytelling to raise awareness, advocating on Capitol Hill. And these toolkits weren't just developed by one person. They were developed by many people in the rare disease community coming together to share what they've learned over time and putting it all in one place to make it easier for other families. And I was then hired by Global Genes to help run some of the rare disease meetups. I then moved on to the Every Life Foundation for Rare Diseases to help run their legislative conferences at Rare Disease Week on Capitol Hill to get more families involved in public policy. I helped create the Rare on the Road Rare Disease Leadership Tour, which was a partnership between the Every Life and Global Genes to help advocates connect one another locally, learn more about their role, your role, and where your experience and knowledge can help, and recognize how public policy can improve the lives of rare disease patients, as well as how to tell your story. I think my family is most well known, especially my son, for our work to help pass the 21st Century Cures Act, which was legislation designed to help accelerate medical product development and bring new innovations and advances to patients who need them faster and more efficiently. My son would draw pictures and bring them to members of Congress to talk to them, to sign on to the legislation. I was involved with the 4 drafts of the bill, and we were there when President Obama signed it into law. And President Obama and Vice President Biden signed Max's school excuse note for missing so much school advocating for cures. So I think my advocacy efforts came from a desire to make it easier for families in the future. No matter what your rare disease is, we all have access challenges, challenges to a diagnosis, challenges to treatment, challenges to care services. I was asked today to share my story and on general advocacy, but I think it's important to share some ways that you can become an empowered advocate. Today, I'm going to highlight one example, how to advocate for your health, and how you can transfer that example to other types of advocacy, advocating for your condition, advocating for the rare disease community, and finding your voice. But as Luciana said in the previous webinar that I watched, you need to focus on your health first before anything else. That's why I kind of picked this as an example. And I love this cartoon because it's so true. Nurse, get on the internet, go to surgery.com, scroll down and click on the "Are you totally lost" icon. Has everyone felt like this when they got their diagnosis? The doctors haven't been as educated on FOP as you would like, or they have dismissed your concerns. So an advocate takes an active role in their healthcare, effectively communicates and asks questions, and is prepared. Ollie mentioned taking an active role, in the previous webinar, and it's important. So how do you take an active role? Your doctor is an expert on medical care, but you're an expert on yourself. Expect to be taken seriously and treated with respect. Become partners with your doctor. Tell the doctor the expectations you have to create a relationship. An active role requires shared decision-making and not just being given orders. How many have you left a doctor's practice because they don't listen? Miriam described a great example in the last webinar about not really being heard when describing her fatigue. She said, you know your body best, and it's so true. So don't feel bad if you need to seek out a doctor who will be your partner and work with you. Every doctor is not going to be an expert on FOP, but a good doctor will take the time to learn and will take the time to learn about your other needs as well. An advocate effectively communicates and asks questions. Doctors will assume you understand if you don't ask questions. So you should always remember the top 2 questions are, what does this mean? If you don't understand, I don't understand, please elaborate. We all learn in different ways. Maybe I don't understand his words and I need him to draw a picture for me to understand it better. And that's okay, but you need to communicate with them and ask. And how do you prepare? You need to prepare as an advocate before, during, and after. So when people are active, organized, and prepared in their care, research shows they have better satisfaction with their visit. So how do you prepare before? Does this doctor accept your specific insurance? And don't just ask the doctor's office, also ask your insurance company, because sometimes someone might have an old list. So check both. Where is the office located? Where can you park? Are the traffic patterns different when it's during rush hour? Do you need to fax over any medical records? And if so, did they get them? If you're doing a telehealth visit, do you know where and how to log on? You should always create a question list. I think most people leave a doctor's office with 3 questions they wanted answered that they don't have answered. So why are you seeing the doctor? What are your symptoms? How are they affecting you medically? How are they affecting you emotionally? How are your symptoms affecting your life? Are there things that you used to do that you can't do now? And if you're on any kind of treatment, always ask, how does the treatment work? What are the side effects? What are the risks of this medication versus the benefits? And how do I know that it's working? And you might have other questions too. Write them down and take them to the appointment with you. So for your doctor's appointment, You can take a care notebook, and I know in the future you're going to have more webinars on how to prepare for things, but I love a care notebook, which is a notebook that you house all of your medical information. I have one right here. I don't know if you can see. This is my nice one I made for Global Genes that has little tabs for medications, you know, a care log, your medical contacts, your specialists, insurance, and research articles. So this is the nice one. You can also bring a list of questions, a list of symptoms, blank paper and notes, your medical history, pharmacy information, any changes to your medical record. I always like having like one of those medical history pages that I get a copy of and save. And then if I go to a doctor's office and I have my partner there with me, I can hand them the medical history page to fill in the new doctor's medical history page. You know how you always have to answer the same questions over and over. Your list of medications, previous doctor information. I would say a family or friend. I know with COVID that's different. I'll go over that in a minute. And additional doctor appointment information if there's something that I'm not listing here that you think that you need. Like I said, I have a paper care notebook that houses all my son's medical information, but some people like to use apps, do what's best for you. And I know many of you have this information down pat, but I think it's important to always revisit because it reminds you, you can update your care notebook or follow up with a physician you were supposed to see 6 months later, but you just haven't had the time to make the appointment. In fact, as an example, with doing this webinar, I realized, hey, I need to update Max's. It's getting kind of messy. So, you know, I need to do that now too after this. So I think this information is always good to go over. And you should arrive 15 to 20 minutes before your appointment. Remember, it's a partnership. Your doctor is an expert on medical care, but you're an expert on yourself. You came prepared. Make sure you refer back to your question list to stay on task. I know it's easy to get off track when you're catching up. It's okay to bring up financial issues with your doctor. They might have resources that you didn't know about. You can bring a friend or family member to take notes. During COVID, you probably can't bring someone into the appointment with you, but you can put them on speakerphone. Repeat what you hear to confirm that you heard it correctly. Clarify any unanswered questions and reach an agreement about a treatment plan. Ask for instructions on next steps. Ask for the actual materials like websites, pamphlets, and videos. Ask your doctor if you can have access to your medical records. You make your follow-up appointments and make sure all your prescriptions have been called to the pharmacy before you leave, so you don't have to wait. Review all the materials you brought home after your appointment. Add the information to your care notebook. And if you have any questions or concerns, reach back out to your doctor. And you should always prepare for emergencies too. I know the association has a great page on their website for medical emergency that you can keep in your purse, in the car, with your family, friends, with your work. There's also medical ID bracelets, and you should also always think about natural disasters. So in future webinars, you'll probably go into more detail on all of this, but it's always important to be prepared. I think a lot of times we don't think to prepare for natural disasters like a flood or a fire, but the more that you're prepared ahead of time, the better. Ultragenics just recently did a webinar on this. I can send you guys the link for that. They just did a blog about it that had a lot of good information. You can also use this advocacy advice as you navigate insurance providers and additional support services and therapies. A quick tip for these types of providers is to always document when you've called them about specific coverage, who you talked to, and what was decided. Hopefully you won't have to refer back to these conversations, but if you do, you'll have all the documentation on what transpired. I know sometimes with insurance companies, you go in that loop, right? You keep calling and everyone keeps saying the same thing. But then if you talk to a manager and you say, look, I've been stuck in this loop, sometimes they can help you jump out of that loop when they see how long that you've been there. Now that we've taken a deep dive into advocating for your health, and after you feel like your medical needs are more under control, you can use the same principles as you move into other types of advocacy. So for advocating for your conditions, IFOPA has many ways you can advocate for FOP. You can share your story. You can raise awareness locally for FOP. You can participate in a clinical trial or research study, or you could fundraise for the organization. They have a page on the website, their website, to learn more. So, and it's not just about what talents you would like to share that you have. It's also about what you'd like to learn more about. I mean, I know boards that I've been on the school board that I learned a ton of information about running events that ended up helping me in the future with Global Genes events and Every Life events that I never thought when I was doing them for the school board would transfer over so well. So there's a lot of things that you can learn from volunteering, not just giving your time. And advocating for the rare disease community. There are many different organizations because it really does take a village. It takes all of us coming together and supporting one another to really make a difference. So Global Genes has Rare University. It's new, it teaches about genetics and genetic testing. It's free that you can sign up for on their website to learn about. They also have the toolkits that I talked about in the past. Unfortunately now, because many of them need to be updated, they are hard to find, but I still find that even though they're older, there's still a lot of really good information in them. You just need to go to the Global Genes website and put toolkits in their search bar, and you can find them on many different topics that way. And Global Genes also has a program once a year. They can match you with a medical student to teach them about your disease. And the Every Life Foundation for Rare Disease has a lot of resources as well. They have Rare Disease Week on Capitol Hill, where you can go meet your members of Congress in Washington, D.C. Rare Across America, where you can meet with your legislators locally. If you're an artist, there's Rare Artist. You can submit your artwork for a contest and have your artwork displayed on Capitol Hill. And if you're a young adult, you can participate in the YAR Academy to learn more about advocating for U.S. policy. So the Every Life Foundation resources are really for U.S. families. And I forgot to mention Global Genes Patient Advocacy Summit, which is another good one. It's a summit. You can also participate virtually. They have tons of different topics. Topics if you're running organizations, topics for if you're a caregiver, if you're a patient. So it's always good to look at their agenda and see if there's anything that you'd be interested in learning more about. And then the Rare on the Road Leadership Tour, which connects you to local rare disease advocates and teaches you to tell your story and find your voice. And that, they actually have a webinar tomorrow, March 23rd at 11 a.m. Eastern. You just go to the Rare on the Road website to learn more. And the National Institutes of Health, one of their centers, the National Center for Advancing Translational Sciences, has a great online toolkit on the drug development process. And you can learn about registries and patient-focused drug development and clinical trials. And it was developed by patient advocates for patient advocates. And then if you're in Europe, there's Eurordis that has other resources as well. So find your voice to advocate. Stories constitute the single most powerful weapon in a leader's arsenal. I love that quote. So here's my son a few years ago when he was 9 years old, speaking at the March of Science in Washington, D.C. about the importance of medical research funding. You are never too young or too old to advocate. You just need to find your voice and what you're comfortable working on. And whatever you choose to advocate for, know that telling your story is an important part of that. So it's natural to try and tell your whole story, but you'll have better impact when you tell part of your story with a clear call to action. So know the right ingredients: the problem, the solution, the call to action. Our rare disease journeys are not simple, they are long, and they are complicated. So it's important to pick one piece of your story to share that's relevant to what you're trying to accomplish. For example, excuse me, if your problem is a lack of understanding of FOP and your solution is to educate physicians about FOP, the call to action is for the physicians to remember the initial symptoms of FOP. So you'd want to make sure that your story includes the symptoms you first experienced with FOP. Another example is if your problem is the lack of government research funding for FOP, your solution would be to increase the National Institutes of Health budget for rare diseases. And the call to action would be for members of Congress to increase the NIH rare disease research budget. Your story would focus on the lack of treatments for FOP and how that affects your daily life, as well as the fact that 1 out of 10 Americans lives with a rare disease. That rare isn't that rare. So they understand rare diseases are a public health crisis. Share with your community. You know, once you put this together, share it with your community. Do they have suggestions on how to improve your thoughts? And how do they describe FOP? I think it's great when you have these conversations with each other because you might like one person's little point and another person's little point. You can take them together and put them together to make something, you know, really neat. So, you know, after you craft what you're going to say and you practice telling it, record it on your phone and listen. You share it again with your friends to see if it makes sense. And it's okay, you know, you want to keep it passionate and you want to keep the emotion of the story, but it's important to stay on task. So, and just always remember, practice makes perfect. I think I'll put in here that my first time talking with a member of Congress, I was so nervous. I had it written down on a piece of paper. I was shaking, I think, even. It was so ridiculous that I was so scared, but that's because I didn't like talking about things. You know, that's kind of out of my comfort zone, which is really funny because now I spend so much time talking to people, but, you know, you get better with practice and then it becomes easier and easier to do. So we can all advocate for ourselves, our family members, our community. Not everyone is going to have time to advocate 100% all of the time, and that's okay. Find what you're comfortable doing and have the time to do it. But please always put your health first, as we learned from Luciana, Ollie, and Miriam. So I'd love to know where you would like to make a difference, you know, and how you're going to get started. So I'm going to stop my share so we can see each other and see if anyone has any questions. I couldn't see the questions during the program.
I haven't had any questions come in yet, but if I think that's a really great exercise, Lisa, is to know, you know, what people are interested, what specific topics people are interested in advocating for. So Lisa went really into depth and shared some really helpful steps for walking through how you can advocate for in a medical setting, or how you can advocate with your primary care provider or your doctor. And that is just one way that people can do that. So I was going to see here. Annalena, are you okay going first? I'm going to allow you to talk. I think your microphone is muted, so you might just have to unmute your microphone first.
Okay, hi.
Oh, there you go.
Hi. I'm not, sorry, can you please say again what you wanted me, what the question was?
Oh, we were just wanting to know if anyone had any specific topics or areas that they would like to kind of discuss how they could advocate in that setting. So is there a specific problem that you're looking to solve, that you're wanting to increase your advocacy or your ability to kind of speak up and create change in?
Please, can someone else talk first, because I
Sure, no worries, Annalena.
I feel so strange today.
No, I will. I saw that Kim had her hand raised. So Kim, I am going to add you in now.
Okay, can you hear me?
Yep, we can hear you.
Okay. Doesn't show the little, okay, there it is. No, it shows a little microphone, but it didn't show any green bouncing when I talked, so just want to make sure you can hear me. So I mean, Hope already knows this. I just got my master's in social work, and actually what I would prefer to do is advocacy work. but I want to advocate for, like, and it's not specific to FOP necessarily, it's specific to wheelchair access. And I don't even know where to begin. The social work group that I belong to on Facebook for South Florida, they have been extremely unhelpful for being social workers. So it's terrible. Like, so I just need some kind of guidance on where to start with the advocacy stuff. I mean, obviously there was some focus on advocacy. I did have to take advocacy classes in my undergrad and my grad, but I still don't know where to actually begin to do it now in the real world, not, you know, part of my education. So
Yeah. Oh, go on.
yeah, if you could just help me figure out where to start with that, since you have the background with advocacy work.
Yeah, so for wheelchair access, I can actually ask a friend of mine who's actually working on some stuff with wheelchair access and get back to FOP to, you know, connect you. But a lot of the disability organizations will be involved with that. The national disability organizations.
Not the local ones.
No, the local ones? Okay.
No, I interned with a Coalition for Independent Living Options as a victim advocate in my first placement in grad school. They don't care about access for people with wheelchairs. They care about the intellectual and developmental disabilities, you know, and just like getting you on government assistance. You know, as far as housing, they just throw the housing list at you. Here, good luck.
There's someone I know in Oregon who's very interested in wheelchair access. So I can reach out to him and see if I can connect both of you to see who he's working with, if that works. He's in the RASopathy's community, but he's had issues with wheelchair access for his daughter.
It doesn't, like I said, it's not specific to FOP, even though I have FOP, but, you know, wheelchair access isn't just rare disease, you know.
Mm-hmm.
It's anybody that's had any kind of thing that put them in a wheelchair, you know.
Yeah.
Whether it's, you know, they fell down and damaged their spine so they can't walk anymore. So, you know, but it's something. And it's South Florida, but and it's Palm Beach County on top of it. We're really rich, but we don't seem to care about us.
I think that was a great example, though, Kim, of, you know, you're wanting to, I know you've done some advocacy yourself on wheelchair access at your apartment. And so I think that is a really good example of one area, especially for our community.
I'm still waiting on them to widen the sidewalk, which they said they're going to do soon. You know, because I sent them pictures, since they clearly weren't pushing the, you know, whole coming and looking at how close my wheelchair is to the edge of the sidewalk. So, but they're going to be working on that. So hopefully next month I'll have a wider sidewalk.
Nice.
Great. Well, thanks for sharing, Kimmy. I saw Nancy, you had,
I threatened them with Disability Rights Florida. I threatened them, so yeah. Okay, you can mute me now.
Nancy, okay. I'm gonna add you in here. So if Nancy, if you had a specific topic that you wanted to discuss or that you're looking to start advocating in, we can hear you. You're unmuted.
I just had a couple of examples, actually. I'm an older FOPer, as most of you know. I don't know who's on, but when I was looking for a new physician, we went to my current long-standing physician, and we brought in ourselves. We brought in our own articles from the Nashville Institute of Health about FOP. That was way back, like more than 30 years ago. And he looked at the article, and he looked up at us, and he goes, I remember this article. I was going to skip it because I'd never meet anybody with FOP, and there were two. So, you know, like you say, advocating and bringing information to your doctor that will enable him to learn more than just what you're saying to on a level of a, you know, medical journal article or something like that. That's very helpful. Another one is for accessibility. Again, years ago when I first became a wheelchair user, my town, I live in a fairly small town in northern Michigan, and I said, we got to get this town better, you know, I mean, because I wanted to go shopping and wanted to go downtown, you know, and all that. So I decided to make a little Mission Possible tour. I took a news review reporter, a Kiwanian, and I think there was one other person, and I put them all in manual wheelchairs. And I each gave them an errand to run in town, and then we were to meet for lunch afterwards. And they said, oh my, this town needs help. And the news reporter did a wonderful article in our local paper. And I think by the end of the summer, many sidewalks were ramped because of that Mission Possible. But we also live on a hill, so they said, boy, that's hard going up and down hills in Petoskey because it is so hilly. But, you know, that's just an example of how to advocate, but kind of in a fun way, not just beating down the doors of, you know, the city council and saying, we've got to do this. Let's give them an example of, you know, how able-bodied people, if they get, you know, put in a wheelchair for just a short time, they learn how difficult it can be to navigate. So anyway, those are a couple of examples of what I've done through the years. But I'm always willing to learn more.
That's awesome.
Well, and what I love, Nancy, about your last example is that in that exercise, you sort of, not that you weren't already friends with the reporters, but you kind of befriended the reporters and brought them into your support circle. So, you know, it brought awareness, but it also expanded your support system, which is a really important part of being able to effectively advocate. So I love those. I hadn't heard that one. I'm glad you shared it.
I've got a couple more, but I don't want to take more time.
Well, did anyone else have questions? We did have one come in through the Q&A, which was, I think for you, Lisa, it was wanting to know if this is a part-time job that you have, if it is your full-time career to work as an advocate or an advocacy consultant.
Yes, so I actually work part-time on purpose, consulting, because I have kids and a traveling husband and things are really crazy, so I didn't want a full-time job. So I needed something part-time. So, and also because I do so much volunteer work that I still want to do with the RASopathy network, and even with, you know, everything that we did with Cures, that was all on the side, not stuff I was paid for. So, you know, I still want to leave time for my advocacy work as well. So, you know, and this is free, and you know, so I was volunteering my time to be here today. So, you know, like there's always, you know, I'm very passionate about moving the needle and all of us working together, no matter if it's FOP, no matter if it's the RASopathies, no matter if it's rare disease, no matter if it's just people with differences. I think we all need to come together as a community and do what we can do. And maybe that's just a 5-minute thing that you could do, is telling somebody about your disease, or maybe that's something that you could do for a few hours. That's where you kind of have to decide how much time you have to dedicate to advocacy, but I don't think it can be done unless we all work together.
And you shared the example of, I think it was a school board that you were on that gave you some really great experience in event planning, which then led to, or which then came in very helpful when you were planning rare disease events. So can you talk a little bit about how you sort of identified, maybe before you knew you had this huge passion for advocating for legislature additional research funding. Like, how did you start to volunteer and to kind of develop that relationship with different companies where you could improve your skills or gain knowledge? Did you just say, oh, like, this is something I'm interested in? Did you search certain organizations, or how did you start that volunteer process?
Yeah, so, you know, I started sort of in my rare disease, but Global Genes was just sort of starting. So I was able to volunteer for them for a long time. You know, before rare disease, volunteering for the school board, you know, the school, I would just volunteer at my son's school. And then they had a position open. So I took, you know, the position of president's, being the president of the board. I think before that I was the vice president, but still I like use those skills that I learned with running events and fundraising and move them over to kind of what I do now. And I think I always say kind of like my ignorance was my success, because I didn't have a lot of skills I do have a degree in biology and one in exercise and sports science, but I didn't do anything for years because I stayed home with my children. I have 2 older children too, that I stayed home with. So I actually had to spend so much time like learning on my own to become an effective advocate, and just watching webinars and going to conferences and taking online classes. You know, I took a class at Harvard in the drug development process. So, you know, there's always ways you can educate yourself. And I think from doing it that way, I kind of learned to see things from a different lens and different, you know, and not from the same lens, not a traditional place. So it kind of like, I guess, led me to be sort of more creative in certain ways, and, you know, really working with others and finding mentors. You know, there's other rare disease organizations, people that I met at like going to the Global Genes conference, that I would then say, hey, I really like your website and what you're doing on this topic. You know, how can I borrow that or learn from that? So I think that that's what's kind of unique about the rare disease community is we all kind of go down the same path, but we're not competing with each other. So we're sharing resources and activities, and it's pretty cool.
And the Global Genes Rare University, that is it's one way that you could start that sort of continuing education or learning something new. And that is free, and it's open to anyone. You don't have to be a US citizen to log into that
Right.
course. So
And
we did have another question.
Oh, sorry. I was going to say, same with the drug development toolkit on the NCAT's website. It sounds scary when you hear like national, you know, National Center for Translational Science, like it's big words, but the website is great. And there's all these different things. If you have 10 minutes to learn about the drug development process, or if you have 3 hours to learn, it's a great resource as well.
Great. We did have another question come in. This one, it was asking in a medical setting. So our doctors tend to listen to us as parents, but how can we improve our working relationships with other medical specialists like occupational therapists or physiotherapists? They tend not to listen to parents, but ask for the doctor's advice instead. So maybe you have a great relationship with your primary care provider, but there's other therapies that your child needs. How do you suggest, you know, bridging those relationships as well?
Yeah, I mean, I think you need to have an open dialogue with them, and also see, like, do you have to use that therapist, or if you feel more comfortable in talking to the, you know, provider that provides that therapist, if it's really, you feel like not a good working relationship, are you able to transfer? You might not be able to, but having an open conversation with them about listening to your needs, you know, as a parent. And try to start that dialogue and try to start there, you know, can I still work with this person? But, you know, if it's not working, then maybe it is time to move on.
Now that's a tough situation, because a lot of times, you know, your children rely on that therapy. But I think that was a great question. So thank you. We had one more thing come in the chat. Oh, Karen, did you want to jump in on that? I think. Yeah, there you go.
Can you hear me? Okay. I just thought I would piggyback on the answer to that. I totally agree with Lisa. If someone's not listening to you, especially a therapist, I mean, usually in the medical community, sometimes people have trouble more with the doctors listening than the therapist. Usually your therapist should definitely be more in tune with what is going on in your home life. So definitely you might want to look into getting someone new. But another strategy that I would recommend that I used to love when families would do with me when I was going into their home and doing therapy with their children is bring with you maybe one aspect of your child's life that you are needing help with. So come in with a set goal of this is what we need strategies or help with, if it's something functional. And then in addition to bringing to them what you want to work on that day, also maybe make a list of here is what we have tried to solve this problem at home. And here's what worked and here's what didn't work, because that's going to show you or show the therapist that, you know, we are taking an active role in trying to help my child build independent skills. And we're really trying at home. And this is what we've tried that hasn't worked. And this is what we've tried that is maybe going to work. And then your therapist can build upon that. And I think by bringing that to the table, they might see that you truly are a willing participant rather than them just wanting to do therapy to your child. They may be more inclined to include you in the entire process. But definitely if that doesn't work, I totally agree with Lisa that above all, your therapists should be the ones that are really more in tune with what's going on with your home life and the functionality of your child and those independent skills.
Our very own Karen Kirkhoff, everyone, IFOPA Family Services Coordinator, at your disposal. So I do not see any other questions or chat in right now, but I wanted to thank Lisa for joining us. As she said, she did this all free of charge. So I know you have a busy schedule that you tend to with all the other organizations you're involved in, and we appreciate you taking the time to walk through some of the basics of advocacy. And I think you'll see, if you haven't already downloaded our worksheet, please check out the worksheet, check out the community panel that she referenced when she was talking about Luciana and Ollie and Miriam. Those are our FOP community members who shared their perspective with us last month. So thank you for taking the time to invest and listen to those and share your knowledge with our community. And everyone, please do keep an eye out for that email with the link to the survey, because Karen and I are excited to send you all your workbooks. So, okay. Well,
Yeah,
thank you so much, everyone. I hope. Oh, go ahead,
I just wanted
Lisa.
to say thank you to everybody for having me here today. And I hope that you continue this advocacy journey. And you're so lucky to have this wonderful organization that provides all this wonderful material for you. It was something that I would have loved to have had years ago when I started my journey.
Okay. Oh, someone else added that if you live in Europe, you get all the same information and help from your RORDIS. I think maybe they were referring to the kind of some of the global genes and the other NCAT in the acronym that you mentioned is available through your RORDIS as well. So thank you so much for that tip. Great. All right. Well, thanks everyone. Enjoy the rest of your day or your evening, and we'll talk to you all soon. Bye.